This video is going to demonstrate how I perform a CCL.
A lateral approach to the stifle. For the lateral suture technique, there are no major blood vessels laterally. So there might be some bleeding, but it's going to be minimal. Move some of this sub-Q fat so I can see a little bit better, because visualization is really important.
Yeah.
If you palpate right in here, and there's a muscle belly right here, you can feel the fibula. So what I like to do is make a cut just right in front of that muscle right there. Just a little cut like that through the fascia there. And then I can stick my finger in here and actually feel the fibula. After that, I'll make a little stab incision just lateral to the patella tendon, which is right there. Into the, I don't know if you noticed that, but there's some joint fluid there.
Yeah.
Made my little stab incision. I take my medicine bombs, kind of find where that joint capsule is, and go ahead and cut the lateral aspect of the joint capsule. You should be able to pop open and get into the joint. Can I get some flesh? Now, I'm inside the stifle joint. I'm going to give yourself enough room to get a look in here. And we're going to get a look at those cruciate ligaments. Use a send retractor. I'm going to pull down. I don't know if you can zoom in on that. You're going to want to remove this fascia here. Get a look at the cruciates and the menisci. I'm going to go ahead and I change to a number 11 blade. I'm going to remove the patellar fat, subpatellar fat that's right underneath the patella. That's going to give me a better view of the cruciate and the meniscus. And I'm going to use, once I've removed the fat, I'm going to use a stifle retractor to get a look inside there. There we go. I don't know if you can zoom in. This looks like he just has one band of his cruciate that's torn, so this is a partial tear. Once you're done inspecting the cruciate and the menisci, then what I like to do is flush. And I like to close the joint capsule. That's good. Thank you. The thing I'm going to do is I'm going to separate the fascia layer from the synovial layer. And I'm going to suture that synovial part closed because it's extracapsular, meaning you want it outside the capsule. So I'm going to close the capsule to make sure that's exactly where the line is. So here, this is just the synovial part of the joint capsule, and I'm going to close that, leaving the fascia intact. So now I have my thumb on the fibula, and I'm going to use a hemostat to go ahead and go underneath the fibula. This is probably the hardest part, and it is painful for the dog, so you might hear an increased heart rate, but I'm going underneath the fibula and then deep to it and then out behind it so I make a tunnel underneath the fibula with a hemostat. I like to use a smaller dog, a mosquito hemostat, but it needs to be curved because you want that curve in it to have it come up. Then I open my sterile line here. This is 80-pound monofilament ethylene oxide sterilized nylon, and I grab it with my hemostat, and I'm going to try to get it underneath that fibula, pull it out. Let's see that. And then I'm kind of flossing it in a way to make sure it's underneath there. Once I've done that, And go underneath the fascia and grab the far end. And bring it around. And I'm going to floss it again because this is the direction that it's going to pull once it's secured. So I really want to make sure it's secure. And if it's secure, you can almost pick up the dog with that. So that's a good test of if that's secure. You can put a car mold or something at the tip of this, but don't do anything on the line because it does weaken the line. I just use that as a place marker. This is 80-pound test monofilament for like a 30-pound dog, so I like to double the weight of the dog in terms of picking a suture line. So now I've taken this needle, which is, I believe, a 14 gauge needle. I've threaded it underneath the patellar ligament, which is right there. And so that's going to allow me to pass that line underneath the patellar ligament like that. Then I'm going to find where I want that line to go through. And I use what's called a glenoid piercer, but if you have a pretty hefty and sturdy towel clamp, that'll work too. So I'm going to find the points that are isometric, and I use this tool to go ahead and will actually make a hole through the tibial tuberosity by gently bringing it up and down and then back and forth. I kind of know where that hole is. I'm going to use this needle again to thread my needle, and why I like to do this is because when you tighten this, it's going to pinch the soft tissue. So by having it underneath the soft tissue, it should be more comfortable for the dog, in theory. So now that's threaded to where this is. Again, I can clamp this with something so it doesn't fall off the table or I don't lose track of it. Now I'm going to remove that, take my needle, go through the hole I just made. This eliminates the need for a drill for this. And I can take the tip of this, thread it through that. Now I have gone under the patellar ligament, through the tibial tuberosity, and now I'm going to go under this little bit of fascia here. To meet up with the other end. So now I've got my two strands. And the next step is to tighten them and secure them. I use the Suture system, so this is an oval sleeve that comes. They're specific for the weight of the line. This is 80-pound line, so it's an 80-pound oval sleeve. You go either direction on the line, and then I use two car molds. I like to use just some straight car molds. I'll go ahead and attach them on either side of the line. I'll stagger them. You'll see why in a second. And then I roll them inward like that, tightening as I go. And then I can lock them by pushing one into the other like that. This eliminates the need for a fancy tightener. And then you'll put a Gelpy in there, and that will allow you to tighten the line without a fancy tightener. Helps to flex the leg while you're doing that. And this is going to be a matter of getting the feel of it. You don't want it to be too tight, and some dogs, like smaller dogs, you can overwhelm it. With 80-pound line, a big dog like this, you can get it pretty tight. And then I use the crimper on it, and I'm going to go ahead and crimp that oval sleeve. That secures it. This can come off. These can come off. Now that line's nice and tight and secure. Lines can be cut. And that's it. All we need to do now is close. So you can. Okay, the last step is closing that fascia. And as you can see, now that crimp is buried underneath the fascia. So we just close up the fascia. Then it's going to be the sub-Q and the skin. That's it. So I'm just testing for drawer now to make sure it's stable, which it is.